Welcome back to the Evolve podcast. I'm Rhiannon.
And I'm your better host, Brendan.
All right, we'll leave it at that. But for now, pretty much what this podcast is all about is self-development, health and fitness, and our journey starting as brand new business owners.
Let's go. Make sure that you share this around because I'm telling you right now, this is the best podcast you've ever seen.
Enjoy, guys. Ciao. So you've worked in many corners of the world, of the health world, I should say. Where did this all start for you?
I was in year 10 and my sister is 10 years older. Her husband-to-be was an avid sportsman, still is, and he spoke about the physio all the time. And I went, oh, my God, I love the sound of that. I can't think of why at the time I thought that, but I just thought, oh, that sounds like it's the right thing for me. And then that was it. Like I just made the decision from that point on that the next 2 years I was going to work hard to try and get into physio.
Yep.
Stressful, but got there in the end. Back then there was only 2 unis teaching physio. One was out, I think, Bathurst way, and one was at Sydney Uni.
Oh, really?
So we didn't have a lot of options. So then I started thinking, well, how am I going to get in if I don't get in straight away? So then I started looking at different undergrad degrees. But every preference was how am I going to become a physio? And I, to be honest, didn't go in there knowing that much about it, apart from I said in my year 12, you know your end of year book that everyone writes in?
Yes. Yeah.
I wanted to be a physio for like the soccer world, like maybe go to like Premier League or something.
Yeah, wow.
I was thinking big. But I did have a preconceived notion. And my preconceived notion was I can't wait to be able to like assess and diagnose and, make a difference that way.
Wow.
And then I got into physio, saw that you could do, chest physio, so cardio, respiratory physio, pediatric physio, geriatric. There was physios for all different things.
Everyatric.
And I thought, well, maybe I'll do pediatric, but I did my placement there and it wasn't for me. I think I was going to be too sensitive in that field, with the kids being sick. So I said, okay, musculoskeletal it is. But I really still had that thing like this is what it's going to be like.
Yeah.
And then what happened was I got married young, did a 1 year placement at the hospital. Then I got married young, so I didn't go into private practice straight away. And then I found a locum position and it was in a sporting clinic, but everyone was kind of treated the same. There wasn't, I said to my physio colleague who went to uni with me, I said, what are we doing here? Like it just feels like it's the same almost for everyone.
Yeah, like copy and paste for each client.
100%.
Yeah.
And I went, this is kind of not what I thought, So I was determined though. I did think that was the whole world of physio. Then I hit the jackpot. So I moved into Randwick area after I got married, my big honeymoon, and I just started ringing practices. I literally didn't even look for whether they were advertising.
Threw yourself right in the deep end.
Yes, and I landed in a clinic with this physio that I could never have asked for a better situation.
That's awesome.
I didn't even know what I was getting into really. So I went in there. She rang me back. She goes, look, okay, I don't even have my resume ready. Like I'm not. She goes, come in. I'm going to go on feel. And I went, oh, okay. So I went in there. She chatted with me. She said, oh, I want to feel your hands. Okay, and then she did that. She goes, you're done. You're in.
Wow.
And I said, oh, okay.
From feeling your hands.
Yeah. And I started to figure out who I landed with. Anyway, the other boss from the locum position rings me. And he goes, because he didn't want to, he said, I can't offer you a position. I'm not guaranteed. So I just left it at that.
Yep.
Oh, Elli, why didn't you call me back? Where are you? Blah, blah, blah. I said, oh, no, I've gotten a job now. He goes, with who? I said, with this lady in Randwick. And he goes, wow, you went to the big guns. And then I started to realise how lucky I was, all right? She's an author. She was on the head of all these committees back then.
Wow.
But she was such a lateral thinker for that world. So we're talking 90s, yeah?
Yeah.
That people sort of had a funny view of her. They thought, she'd be kooky. Like she was so ahead of her time because she studied anatomy for 3 years. She said she was in the anatomy labs for 3 years, just looking at the anatomy and analysing it.
Wow.
Wow, they only
So-
do that for one semester now, isn't it?
Yeah.
Yeah.
But she didn't have a full anatomy degree.
Wow, okay.
So she goes, before I even say I'm a physio, I'm an anatomist. And I said, okay. And that is where I just went, it blew my mind because she looked at the whole body, which is exactly what I thought it was going to be like. She looked at the nervous system, the cranial sacral system, so your sacral bones, the sacral flow.
Wow. So she went deep.
Yeah, so she was telling me, look, I can do this, and that person's left calf tension's gone. She was treating their head or
Wow.
like C01 of their neck.
That's crazy.
And I'm just like, oh my God, this is freaking amazing. She was an acupuncturist. Everyone was a Japanese acupuncturist in that clinic. So I went and
Yeah.
did that course. So happy I did it. And it just opened my mind to the fact that we have to look at the body as a whole. Emotional, physical, systemic.
Yeah.
So as I've evolved as a physio and just as a person and my personal experiences and my, work-related experiences, I realised that I can't not see things. Like I have to be able to know that that person going through that trauma affects their life and how their pain, their pain responses are.
Yeah.
So then over the years, so I worked with her for 4 years, but I felt like my learning had sort of slowed down a lot. And so I said, who am I going to go to now? I can't just go from this person to anyone. I need another mentor. And I had met this other very well-known physio in the industry while I was at uni. She came and taught us one lesson and one practical on something called the sacroiliac joint. And she spotted me in the practical session. She goes, "Ooh, you need a bit of work. Your body needs." I already had one child by then, so she spotted some issues with my strength and control. And she goes, "As a physio," oh, sorry, no, that was in uni. I didn't have a baby by then. Sorry. So she spotted issues from then, but that was from studying.
Yeah.
Yeah.
Really bad posture from studying. And so she goes, come and see me as a physio and we'll set you up, we'll get you some exercises, blah, blah, blah. Anyway, I did that. She said, don't forget me. I'm going to probably forget you, but you don't forget me. And whenever you're ready, you come back to me. Whatever she saw in me, I don't know. Well, I didn't forget, gave her a call, and again, didn't look for advertisements or anything. She rings me back that night and she goes, oh, so you saw the ad I put out today? No. She couldn't believe who I was working for. Utmost respect. So for her, she was very interested in me because I came from her. And she said, both me and that physio come from the same place, just in different directions, but we meet in the middle. So then I spent 6 years with her and I just went through a huge learning curve on top of everything else. She saw a lot in my ability to teach. So I became part of her teaching practice, her teaching, business. So I went all over Australia teaching physios how to rehab backs
Wow.
and hips. So I travelled a lot. I would be her tutor for her courses because she still is teaching courses. So I was going along, tutoring along with her.
This is a new one, right?
This was the second mentor.
The second mentor.
Yeah. Wherever she couldn't be somewhere, so at a big conference talking, I was her stand-in. So I got all these opportunities. So I went on to Day Extra. So I got all these opportunities through her.
Wow, there we go.
So I'm so forever grateful. So we're still friends and I'm still learning and respect. I saw her at the World Back Conference. That was a privilege to be able to attend because they never usually do it in Australia.
Is the World Back Conference?
Yeah, the
Really?
World Low Back Conference. And they usually do that in Europe.
Okay.
So it was very rare.
But
now-
they brought it here.
I'm telling you, the people that were there are the people that wrote the textbooks. Yeah? So we're
Oh,
talking
like the
about...
textbooks for uni and everything like that.
That's awesome.
So Andre Vleming, big name in the industry, wrote all the stuff about the pelvis. Diane Lee. So Diane Lee is a Canadian physio who wrote the first ever textbook on the pelvis and the rib cage, the thorax.
Wow.
I was very fortunate to do a 10-month mentorship program with her 2 years ago.
Wow.
Probably not less than 2 years, but close.
So to people that don't know, this low back conference, how would you explain it to people? Is it just a bunch of people that are experts in the field that do talks to other people that are in the industry?
Yep.
So other physios and stuff like that?
But it's a very eclectic group. You sort of got to be in that back pain world to know about it, be interested in it. It's all the latest research from all over the world.
Yeah. Not open to the public, is it?
No. It's for clinicians, clinicians.
So just physios, and it's physios that focus on the low back as well.
Any physio can go, but it would be the physio that would be interested in all of that.
Yes. Yeah.
And so what happened with me was, so these two mentors then made me more of a specialised physio in back. When we say back, though, we're talking about all of the spine, you know?
Yeah.
The rib cage,
like
head to toe, down to the pelvis and the hips, because you can't ignore the hips. Because the hips and the
hips don't lie.
Yeah, exactly. Yeah, exactly. So that's where my kind of mentoring journey took me, and then I took it all guns blazing. Because I used to always say to my husband, "Oh, I've been so lucky to have these mentors in my life." He goes, "Yeah, but you kind of put the hard work in too."
Yeah, I was going to ask you, do you believe it's luck or hard work?
Both.
Yeah.
Both. Like, people came and went. Let's just say, lots of physios came and went. You've got to have that drive. You've got to have that passion.
To continue on.
You've got to, and just that. And it takes a certain person, and you'll see that in a lot of really high-achieving health professionals. There's an exhausting component because you're such an empath. You really invest in your client. You're there for the long run. And one of my ex-colleagues used to say, when you make a client, you make them for life. Yeah? Not because I want to see them every day for the rest of their lives, but you help them so much and you leave such an impact on them that they'll tell all their family members. They'll come back whenever they need you.
And that's your marketing.
Yeah, your client, their friends, their colleagues. That's how you know you're helping someone.
Yeah.
Because they're sending everyone else to you saying, blah, blah said, you're going to help. So that's the satisfaction you get, like out of all of it. It's just, how can I help someone be the best version of themselves? But, I reached out to you guys because there's a condition that both my ex-bosses, but mainly the one that I did 6 years with, the last one where I did all the teaching.
Yeah, the second one.
She's the one that specialises in the sacroiliac joint. And since starting my own practice, which was 10 years ago now, I continue to work with the only specialist in that area. And I was always worried leaving her, was I going to continue to learn? That was my biggest concern. Because at that stage I was pregnant with my third kid. I wanted more flexibility. So it wasn't for any other reason, but just that flexibility. But I just wanted to know, am I going to still learn? I'm worried,
Yeah.
But man, it's been exponential because I've been really lucky to continue to see this client, see lots and lots of them, figure out what works, what doesn't, and work with this specialist the whole time. And so the learning has been great. But I still have this disappointment because we've come to the stage where she's now very at the end of her career, this specialist. She's tried to, upskill other doctors in this niche area and it hasn't kind of worked out yet. What are we going to do when she's not around, The problem is I'm still getting patient after patient saying to me, why do I have this problem and no one can find it but you or her?
Yeah.
Or thank God I met that women's health physio who knows of you and her. Or thank God, this person said something and I finally got to come to you.
Yeah.
And it's like, man, it's been like, 40 years of trying to get people to accept that this condition exists. And I had another chat with and her name is Dr. Jenny Saunders. She's a sports physician. She's done the Olympics, Commonwealth Games. And I said, why, Jenny? And she goes, because there's still doctors, there's still, health professionals that don't believe the joint can ever become unstable. So where is this joint, right? It's in the pelvis. Your dimples?
Yeah.
It's there.
What, your butt dimples?
Yeah, you know those dimples at the back?
Yes.
That's where the sacroiliac joint is.
Okay.
That's like the end of it?
So no, that's the actual joint underneath. So it's called your posterior superior iliac spine. So you've got your sacrum, which is your triangle bone.
Yeah.
Then you got your tailbone underneath. Then you got your two iliums, which then form the hip socket. Yeah. It's the joint between the ilium and the sacrum.
So right between the ball and socket joint in the hips?
No. Have you even gotten I should have brought my pelvis. So there's the ball and sockets on the side.
Yep.
Come around the back. Okay. Where your spine ends and you kind of ends in like that. There's two dimples there. That's the joint.
Oh, so it's where the spine connects to the hips in a way. Okay.
The spine the spine, yeah. You could say that. But the hips, it's not the hips at the front. It's that big kind of winged bone.
Okay.
Yeah.
Yep.
Yeah, I feel like a lot of people can understand that then.
Yeah.
It's the bone that hurts when you hit the floor.
100% you nailed it.
There we go.
So that is the main way to injure it.
Okay.
Okay?
There we go.
You got it. So the main mechanism of injury is falling on your bum, even falling on your hip to the side. Unfortunately, childbirth can do it. It's a common injury there. Car accidents. So say someone hits you from behind.
So it's lots of trauma-related injuries. Yeah.
That will cause a mechanical issue to that joint. What that means is something structural will be injured, usually the ligaments.
Yeah.
Okay? But I've had patients fracture the sacrum. So the whole bone just cracks. That can be related to some osteoporosis possibly, but yeah, they can fall on a really hard surface like concrete. That can happen.
Mm-hmm.
Yeah.
And that's more obvious. Like you go, all right, that needs to heal. But then what happens is people then still end up having some sort of pain coming from that area. And that's more the non-obvious stuff. And that's usually the ligament. And when you're injured, all right, pain inhibition exists. So any type of injury, shoulder, wherever you get injured, if there's pain, the muscle surrounding will get affected instantly. Like it's pretty quick.
Yeah.
So you do your knee, what happens to your quads? It starts wasting away.
Yes.
Yeah. Same with this, no different. So if you injure this joint,
lower back,
glutes, back, what needs to take over if your glutes are switched off? Your hamstrings,
Yeah.
your hip flexors,
Quads.
your big erector spina, your big back muscles, So all these are, and so when you're trainers, so you see these patients, these clients, and they've got those big rods in their back. Have you seen them?
Yes.
Yeah, they're doing that. That's compensating for something.
Mm.
Whether it's core strength, weak glutes, they're lordotic, but they're still compensating, So I was going to say before, so car accident, say you got your foot on the pedal and you get hit from behind, where's the torque?
You go straight into your
Up
hip.
into your leg, into the hip, back into the pelvis. So that's common. But then that's mechanical dysfunction, all right? So then you've got non-mechanical. So non-mechanical is the whole muscle system, something's wrong.
Okay.
So an imbalance?
Yes. And that can still create a pain response from the sacroiliac joint. That can be a source of pain even with a muscular imbalance.
So what are some ways to prevent the imbalances from happening?
That's right. So for instance, say you've got a job that requires something to be done repetitively, that can cause an imbalance. Yep. So the key is not to allow those, have you heard of the muscular slings of the body?
No. Tell me about it.
So you've got your longitudinal and your diagonal slings of the body. So they're groups of muscles that work synergistically, which means they just work together as a team, okay? Creating forces to go across the thoracolumbar fascia. So fascia?
Yeah.
So you've got this huge kind of triangle fascia right in the middle of your lower back, like kind of your sort of between your lower back and your mid back.
Yeah.
That distributes all these loads and forces across your back.
Okay, makes sense.
So if something, say your lats don't work, but your glute max does. So your lats form a sling across your back. Okay, so from your lats to the fascia to your glute max.
Yeah.
All right. If your lats don't work because you sit down all day at a desk, you're like this, your serratus don't work, your multifidus doesn't work, your glute's either going to take over, your piriformis is going to get really tight.
Yeah.
Okay, that causes a dysfunction. Okay. So
I never
basically,
thought of that.
yeah.
So you're saying if your back's switched off from slouching all day,
Yep.
your glutes will switch on. So that's probably why a lot of people have really tight glutes then.
Exactly. And usually it's the deeper glutes though. It's the stuff underneath.
Yeah.
You know, your piriformis, your hip external rotators, internal rotators, like all of those muscles, they get tight.
Wow. Okay.
Got it? So you can then, but the reason why you can develop back pain or SIJ pain just from that is because the fascia has attachments to the ligaments of the SIJ.
Okay.
Which are so important in creating something called force closure. So every joint in the body has form and force closure to make it stable. The SIJ's role, this is huge, right?
Yeah.
Is to absorb forces when you walk, run, step up on a step, so it doesn't go as full on into your spine, because in our spine, what have we got? We've got discs. They're vulnerable.
Makes sense.
Got it?
Yeah.
So your SIJ, this is why there's so many doctors out there go, no, man, it is such a stable joint. There is no way you're going to injure it. It can't be a source of pain. You can't do that.
So is that why a lot of people have like disc-related injuries, like herniated discs, bulging discs, which a lot of people would probably understand. Do you think that happens because they've got weakness in that sacroiliac joint?
It can happen. So we have patients that come in who have multiple things going on. You go, and this is where me and my vision as physio was, I wanted to diagnose people.
Yeah.
I wanted to be, and so my ex-boss used to call us diagnostic physios, and that's what I am. But I think all physio should be. Why are we not taking the time? Why are we not taking 1 hour assessments to figure out what's going on anatomically to these people? Put a list of all the things that you think's going on.
Yeah.
Because you don't have to get the one thing straight away, but say, okay, so I can see from all but you got to know how to test. You got to know what to look for, yeah?
Yeah.
So that's where you educate yourself, and then I'm going to go on a tangent here. See how I said I had 2 mentors? That was 10 years of mentorship.
Yeah.
And then I opened my practice.
Wow. So you put yourself through that 10 years.
Of course I did. What happens if I didn't do that? And I go to every freaking course there's available,
Yeah.
but I don't put hardly any of it into practice. Does it even mean anything? No.
You can study your whole life, but actually putting it into practice is where you actually get the
And
result.
that's hard to do when you go to a course and then go, all right, I've got to take this back now on Monday and figure out how I'm going to do this with my patient. You need, young physios, please, if you're listening, find a mentor.
Yeah.
Do it. Because if you don't, that's where all the learning happens. The degree is foundational.
Yeah.
I wouldn't be where I am today if I didn't have those mentors and then continued in that journey. It's the way to kind of become that physio, that physio that can assess. So, for instance, back to your question. They come in and I see them and I go, okay, I've assessed their pelvis, their back. I've done the test to see because they're telling me, say, for instance, I've got back pain. It kind of goes across my back, down into my glute, maybe to the side of my leg a little bit. I'm like, oh, God, that could be a million things. It's what's saying in my head. So I've got to figure that out. So I start to do all the tests. And from that, I realize, okay, so, all right, this could be, I'm eliminating one by one based on the tests. With SIJ, it's the same. There's a battery of tests that you have to use. And if you get 3 out of 5 of them, 4 out of 5 of them, it's pretty conclusive. They've done the research on it.
Yeah.
So we look, and that's how we diagnose, right? So we go, all right, so if someone came and I thought, God, it feels like there could be an irritated disc here, that takes precedence over the sacroiliac joint for now.
Okay.
Because if you've got an irritated nerve and I start shuffling around stuff underneath it,
It's going to put
irritate
more pressure. Yeah.
it's going to irritate it. So that takes precedence and then everything else follows.
Is it top down? I feel like someone's told me you go top down.
I don't believe in that. So apparently there's a school of thought. I think it's more a chiropractor thing, but I could be wrong, so don't come at me. But that the jaw affects the back. I believe in figuring out what the driver is.
Yeah, because it could be from anywhere.
Yeah.
Because I've also heard of people that do the foot affects the back.
100% it can,
Yeah.
if that's the driver.
Yes.
If it's not the driver, then it can't. I've got to, so my other passion, if there is a room for it, that I chose myself is to treat TMJ. Love it. I could go on and on about TMJ.
What is TMJ?
The temporomandibular joint, jaw.
Okay.
Okay. And I just did a 8-minute reel on my page on Instagram about it. Just a little masterclass
Yep.
Yeah.
talking about the TMJ, the teeth, alignment, all of that. But so I can tell you now that I know about the TMJ and it can affect your whole body when it's out of alignment. 100% it can, because guess how? If it's out of alignment and it affects how your cranial bones sit and your cranial pulses and all the flow going from your brain down into your nervous system.
Going to put pressure on your neck and then that's going to flow down.
Yeah, you got it.
Wow.
So everything basically connects, and you need to be aware that if there's pain here, it's going to affect your neck in some way or your shoulders, and that's all going to transfer
It
down as
can,
well. Yeah, it can.
depending. The muscles play a big part in that. Depends how strong you are, because your spinal strengthening system has 2 layers, right? So you've got your deeper layer, which are your stabilizers. So they're the ones that you guys say are the core, yeah?
Yeah.
They are meant to turn on even before you start moving. Okay, that's what they're meant to do. Your brain's meant to tell them, stabilize. But what's great about them is they then come on they have a role even with movement. They're meant to even stay on and assist dynamically as well, not just statically.
Yeah.
So it really comes down to how good that system is. Like if your system's good, you're pretty lucky. You know, you should theoretically have
Prevent a lot of things.
Yeah. Okay. But it's not just the core, okay? So we spoke about the slings before, yeah? Once you fix the core and get it working, and you got to layer things on. You got to become functional.
Yeah. And that comes from strengthening the whole body rather than just focusing on the core.
Yeah.
Yeah.
You nailed it. So that's pretty that's you see that a lot on social media. People post a lot about functional training.
Yep.
But the missing link, guys, is what I see in the clinic. I have patients that go to Pilates, and I feel I have to be very sensitive when I speak to them about their core, because they feel that they've been training their core.
Yeah.
My core, I've been doing it for the last 2 years. And
Yeah,
I go,
I've been doing the little Pilates machines.
yeah,
and
the
everything.
reformer, this,
Yeah.
that. And then what we use is real-time ultrasound, so the normal ultrasound machine, because it takes away all the guesswork. We look at their bladder, we look at their transverse abdominis. There's other muscles you can look at too. And we get them to do the core. And sometimes they do it well, but generally if they're there to see me because something's hurting,
Yeah.
the chances are they're not.
Look, I love Pilates. I can't knock it. It's really good for your core. But nothing beats a traditional back squat.
I agree with that, but only if you know how to turn your core on properly.
Yes.
That's the missing link. So I had my cousin came to saw me. She saw me. I hadn't seen her in ages. She goes, "Gosh, I've had the worst back pain for so long. I can't sleep properly." And she was doing a full-on 5 days a week reformer Pilates at this franchise that we know a lot about. And I said, "What?" I go, "But you're doing 5 days a week of Pilates and you're in so much pain.
Yeah.
Come and see me," I said to her. "Just come." She goes, "Okay." I fixed the way she did her core. She goes, 6-pack now. She still goes. She hasn't had back pain since. She still goes, but she changed the activations.
That stuff makes a huge difference.
And I don't care what anyone says. There's all this movement out there that the core, why do the core? It'll just come on. Everything just comes on.
Yeah, it just switches on automatically.
No.
Yeah.
It's
I wish it would have
maybe
that.
for some people, but rare.
Yeah.
Rare, especially if you've had a history of back pain at any point in your life, or if you've fallen on your bum. Look, I've got teenage kids. Like, how many times have they fallen on their bum?
All the time.
My
Pretty often.
17-year-old, I cringe because he's probably fallen on his bum 4 times. Do you think it's a coincidence then that not long after that he tore his quad at soccer?
Makes sense.
No.
No. So luckily he's got me. I rehabbed him. but he didn't do them enough, and then he tore it again, and then he did them properly, and now he's been fine ever since.
Yeah. But there's lots of kids out there that are doing that. It's happening to them. They're getting injured, but they still don't know what it is.
Yeah.
And physios are treating it as it's just a quad tear.
That's right.
Not worrying about
Thank
the hips.
You. Thank you. As long as every physio can start to know how to screen the pelvis, screen everything. I'm not saying that it's always going to be the source of pain or the problem, but at least give it a look into. Mm-hmm. But that's the issue that I've got is that it's still not happening, and it's been a long time, and still I'm still the only one, sorry, not the only one, I'm still one of very few physios that is doing it properly.
Yeah.
So like that means, you know, people have to wait 6 to 8 weeks to come see me. That's not fair. When it's in a chronic pain situation, I mean, they've been waiting all their life because they're in pain for so long. But so now, you know, what I've done is I've trained up my physios to be able to do it.
Yeah.
You know, and there are other clinics, and I'm more than happy to refer to other clinics in all different parts of Sydney, but there's not many.
Yeah.
There's like 4 or 5. Okay, I should clarify something though. There are women's health physios that know about the pelvis.
Yeah, I can imagine.
Okay, but the experience of seeing people with sacroiliac joint dysfunction is different. So people say to me, oh, so you're a women's health physio? Because I say, oh, I treat the pelvis. And that's instantly what they think.
Yeah.
I go, no, I'm not. I don't do internal examinations, but I work with women's health physios because where I treat can be very interrelated.
Yes.
Yeah. It's more pelvic girdle pain, pelvic dysfunction. It's that kind of stuff. So you can have, you know, pubic symphysis pain at the front, SIJ pain. The issue is I think it's the fact that if you are a pelvic physio but more women's health, you're not going to then specialise in that area because you've got other things you're doing. So it's knowing when and how to refer and what and experience treating that over many years to figure it out, or at least sort of upskill yourself as much as you can.
So what do you feel like physios should be doing? Because I feel like it's pretty hard to get them all to start researching and studying SIJ pain. Should they be looking out for signs and symptoms and then refer on?
Until they feel more equipped to treat it.
Okay.
Yes. Yeah, because there's stuff on the internet to read. When you're on Instagram, I follow a lot of people on there, but a lot of them are American. They look at the SIJ a bit differently. And they don't do the same interventions as we do. They do a lot of fusions. So they will screw the joint together.
Wow.
Instead of actually fixing the problem.
Yeah, their rehab's not as up to scratch. I've seen some stuff that's very questionable, what they do. And I've even, can't help myself, private messaged a couple of them, not private, like messaged them and said, oh, I'm not sure if that's right for the SIJ. You might aggravate the ligaments there. And they're all really good and open. Just learning to understand how to assess it. Look, I've got a new physio on board right now, Michael, and he hasn't been taught it. He's 2 years out. So it takes time. And the physio that I had, Kira, who's now understands it, it took her a good 3 years to figure it out properly and still learning, So it takes time, I think, for anyone. Go do a course, figure it out, break it down, figure out when you can. You know what it is? I'm not an expert on everything, but I know when something's wrong, I can pick up the cues, the signs that something's wrong beyond my capability. So then I will go, okay, I don't do, concussion physio, but I know you need it. You've got all the signs.
Yeah.
Then you would refer on to
100%.
concussion physio.
100%.
Yeah.
You mentioned before that you obviously reached out to us and wanted to jump on this podcast. So was it to sort of create more awareness around this SIJ joint?
Yeah, that's what it was. I just feel like we're getting to the pointy end now where, the specialist that I work with is, getting closer to the end of her career. And still we sort of haven't made a lot of ground, and also just out of a bit of frustration just because I still getting the same story from patients. Like it's just taken so long for me to be diagnosed.
Yep.
So I just thought, you know what, maybe I have a bit more time now because I've got more physios working for me. My kids are older. Maybe I'll advocate a bit more for this.
Yeah.
Yeah.
I like that. And at what point in a physio's career do you believe they should start specialising or niching down?
So that's such a good question. I think what physios need to understand is finding a niche is really important, and I really promote this in my staff. Okay, I go and I say to them, I will support them in whatever niche they want. So, for instance, Kira, after a year with me, I said, all right, have you thought about what kind of area of physio you really like? Do you like headache physio? Do you want me to help you learn more about that? How about vestibular physio, women's health physio? She goes, well, I'm leaning towards women's health. I said, okay, I'll support you. And that's where we're at. So I think it's really important that a physio does figure that out. I really do, because if you want to talk from more of a business perspective, it's really good to find a niche.
Yeah, I was going to say that.
Yeah. We talk about that in the physio world, that it really is helpful from a marketing business perspective to have a niche because it keeps you busy consistently, sort of makes you stand out from the crowd type thing.
That sounds interesting though, because you won't be seeing general patients anymore. You're only going to be seeing a specific population.
Yeah. So you got to be happy to accept that.
Yeah.
So occasionally I get the ankle. And they always seem to come in like droves. Like one week I have 3 ankles and I'm like, oh my God. And it's a good relief, I like it.
Yeah.
But yeah, you have to accept that that's where you'll probably head into, is a more of a niche market. But if you find something you're passionate in, it doesn't, you love it.
Yeah, 100%.
No matter what.
You had 2 mentors in your career and they both went for around 10 years, right? How important?
Over 10 years, yeah.
Over 10 years. How important do you believe it is for a physio to have a mentor?
Well, yeah, I tapped on that before. I think it's so important. It disappoints me because I was looking for a physio for so long, and I was advertising myself as, a mentor, a mentor in back pain, complex back pain or whatever. I couldn't hire for ages. And I'm like, isn't this what they want? What do people want? Like, I thought people wanted, like, I had these mentors. I jumped at the chance.
Yeah.
Don't people want it? I think there's look, I've had some physios come and shadow me, like watch me work, and some of them that are newer in the career find it quite intimidating.
This episode is brought to you by Dynamic Recov. You're not lazy, you're just busy. But let me ask you this. How much longer are you going to let your health take a backseat to your calendar? You already know what to do. Train, eat well, stay consistent, but knowing isn't the problem. Doing it while running a business, managing a team, or raising a family, that's where most people fall flat. At Dynamic Recov, we coach high-performing professionals to take back control without adding more to your plate. We give you a clear plan, real accountability, and full access to our coaching team right from your phone. Use code EVOLVE at checkout to get 50% off your first week. That's EVOLV. Hit the link in the show notes. Start now before later turns into never. Now let's get back to the episode.
And the original mentor I had said, I won't hire a new grad because they need to understand how it is just to be a physio, number one.
Yep.
And when they're ready and feel that they can become a little bit more, specialized or just feed into it a bit more, you don't have to, just to become more diagnostic, then we'll take them on board. But I wasn't even getting that. I was like, I'm not even getting the, because you've got 2 ends of the spectrum. You've got a physio that's so experienced, they're hard to change.
Yes.
Like they're stuck in their ways. They're happy. It's working for them.
Very close-minded.
So, I don't like to say that, but yeah. I've hired that, and that was really difficult. And then I've had, the newer grads come and shadow me and go, one was really good. She goes, look, this is not me right now. Maybe in about 4 years. I go, okay, no worries. I respected her honesty. It was good. So it's hard for me. So the two physios that I've had now for a while, one knew me as an acquaintance, and she didn't have a mentor, but she was, 10 years in her career. So she reached out to me and said, look, I know what you do. I'd love to learn. And the second one was my patient.
Oh, wow.
And I said to her, if you want a job when you graduate, she goes, I'll consider it. And she did go for the hospital system first. But the difference now with when I was at uni is the hospital system don't have enough placements for the amount of physios that are graduating.
Oh, yeah.
So it's really hard to get a job in a hospital.
I can imagine.
Yeah. So she sort of goes, my heart wasn't in the hospital. She goes, so she rang me and I was so happy. And she reminds me a lot of me. She is really passionate, heaps of energy, just happy to be there, learn, sponge, takes all the feedback on.
Yep.
That's how I was. And see, going back to what you said, I think I was sort of that person that obviously helped me along my pathway. It wasn't just because I fell into luck. So I've kind of had to accept that over the years.
In terms of your mentorship, in that first 10 years, was there ever an inkling for you to open up a business?
Yes. So
What point?
It was quite. So when I went from the first mentor for 4 years and I found the second one, I actually said it to her only once, but I knew at that point I wanted my own business. Yeah.
Okay.
And I was. I think that I handled it well. I said to her, that is something that I would consider in my future. I'd like to consider. And she goes, yeah, I understand. She goes, look, it's not easy though. And I said, okay. And I never spoke of it again.
Yep.
Never. And to be honest, I didn't know when it was going to happen. I was young. I had kids young. I didn't know when, where, what. I just thought I left it, as I would say, up to God.
Yep.
Yeah.
Left it to fate.
Yeah.
It's good. I like the way that this podcast is flowing. So you've obviously dived into the world of physio and all the ins and outs of the SIJ joint and everything like that. And now we're diving into the mentorship. And obviously I just brought up the question about the business. So part of what we do on the Evolve podcast is talk about business
I love that.
and try to get to understand the mind behind what it takes to run a business on top of the knowledge behind it too. So
yes, that's really important.
Yeah, you've done those 10 years, of mentorship and learning as much as you can have now developed through that mentorship into this business now.
Yeah.
And now that you're running this business, tell us a little bit about what your business is and what you guys do.
Okay, good. So I'll just say that when I was with those two bosses, I think subconsciously I was obviously taking notes.
Yeah, you were surrounded by it.
By how they ran their businesses and all of that. So I wasn't doing it on purpose. I think it was obviously all subconscious. So once I started on my own, and I was really lucky to have support. So I could work really long days, so 12-hour days, probably 4 days a week when the kids were little. So and then I had to take that real. I was nervous about hiring. And so I eventually did do it, but it took me a few years to find who I have now.
Yep.
And they've all stayed a decent amount of time, so I'm really happy with it. And what I found the key to a successful business is give and take.
Okay.
So I'm pretty flexible to a certain degree with my staff as long as they work hard.
Yeah.
And when I mean work hard, they're there, they're invested for the business, for the patient. And then because then we play hard, you know what I'm saying? We work hard, we play. That's my motto, right?
Yep.
So
give and take.
I found that I almost hit burnout a few times. Okay. When I was doing a lot of teaching and, working, and I just thought, oh God.
Spreading yourself very thin.
Oh God, I can't tell you. I didn't want that for them, so it's a big part of my business.
Okay.
Is
to help them prevent burnout?
Yes.
Okay.
Huge part.
Yep.
So from all aspects, like I make sure they have a 1.5 hour lunch break booked in.
Cool.
I pay for that half an hour, but the 1 hour is unpaid. They can do it to catch up, whatever. If they're running late, whatever. But it's so they have a point to breathe.
Yeah, it's a good process to add into their day.
Yeah.
Because it gives them that opportunity to take that breath.
I encourage them every 4 to 5 patients, they do get a catch-up spot.
Yep.
Okay, again. So again, breathing space, notes, whatever. I make sure there's a good culture. So I give them bonuses at Christmas, lots of good prezzies, and for their birthdays. We celebrate them all the time. We try and do about 3 or 4 outings a year as a group. The last, was it 2 or 3 years, our Christmas party's been taking them away.
Oh, awesome.
Oh, I like that.
So Hunter Valley for the weekend. What was the last one? Oh, we went to the Whale Beach for the weekend.
I might become a physio and just work a year.
Yeah.
Work with you.
Yeah.
I'll go away.
Yeah, we fine dine restaurants.
Oh, nice.
I've always said to them, it's all about, I'm not here. I'm running a business, yes, because financially it's nice to run a business.
Yeah.
But I can tell you, it took a while.
To get to that point.
Yeah.
Yeah.
Like I could have easily been working in the senior position at the hospital
Yeah.
Yeah.
with the same amount of money. But I got so much more satisfaction out of what I was doing for so many more reasons, because there's so much involved. Overheads, the more staff you have, it's just lots of expenses. Like there's a lot
of
involved.
learning.
Yeah. And I've been really fortunate. So I haven't had to market my business up until this year. So for 9 years, I've never marketed because of the 10 years I did before that.
Word of mouth. Yep.
Doctors knew me.
Yep.
Patients knew me.
Lot of
Creating your
referrals.
name.
Referrals, yeah. So that I don't think young physios realise. You just actually don't have to work as hard to make sure it gets running quicker.
Yeah.
But this year I have engaged a marketing company because I had some big things happening. So I hired a 4th physio and I wasn't confident that we had enough spillage. And I hired my first male physio, which I was really excited about.
Awesome.
Yeah, and that's working out really well. And also I've just soft launched a rehab program.
Cool.
Yeah, called Spinal Fit.
Yep.
And I want to take that a little bit further eventually. So at the moment, it's all just in-house. And it's, this whole slings and graded system and everything I was
The
talking to you
things you were
about.
talking about before.
Everything I have learned
Yeah.
from how to rehab a back
In that.
is in that.
Is it a course or is it
It's
something?
an 8-week program because we know that it takes 6 weeks to reprogram something in your brain.
Okay.
Okay?
And is this a training program, like exercise program
Yes.
or educational?
Both. And that's the point of
okay.
difference.
Yeah.
So I wanted all of the way, all the stuff I'm talking about,
Yep.
I wanted to teach that at the same time as the exercise program because when patients listen to what I have to say about why we're doing things, they become more compliant. They go, now I know why I'm doing this and now I know why I have to do it.
Especially when you feel it through the exercises
Yeah.
as well.
Okay?
Is this something that you actually coach them through or is it like a program they purchase and do it on their own?
So at the moment, it's coaching.
Yeah.
It's only in-house. So it's going to be run in-house, 8 weeks, but they get online exercises with videos
Yeah.
and paper exercises too, and the educational sheets with it,
That makes
week
more,
to week.
It makes more sense to be coaching because sometimes people receive a program. It's like, oh, cool program. Never
Yeah.
say it again.
Yeah.
Yeah.
So at the moment, that's how it is. I would like to eventually, possibly, I don't know, but give it out to people, but as if I'm their personal trainer as well. So not in person,
Yep.
but that's going to require a lot more development.
Yeah.
That's
It's like
the
an
future.
online coaching model. In a way.
But like
We can help you with that.
Yeah, definitely. So like basically they're coming for their session with me. I'm talking with them, telling them what we're going to do today, talk them through, demonstrate, then they do it.
Yeah.
Yeah.
And you do that all in person, in-house right now.
Yes.
Yeah.
Yeah. So we just launched it. I'm very excited because it's something I've been working on for 2 years. So yeah.
I like it.
Yeah.
I know I'm bringing this back just a little bit.
Yeah, go, no problem.
But with the lower back, I feel like it's such a common injury. Everyone that's probably watching this podcast has had some sort of lower back pain or injury at some point
Significant
in their
burden
life.
on society, actually. There's a very high percentage.
Huge.
Mm.
Why aren't there more physios kind of focusing on it?
There is. It's probably the most thing we see.
That's what I mean. So why
Yeah.
do not more physios know about this SIJ problem you're speaking about?
Because as I said to you, there is that school of thought that people don't believe it can be injured.
Okay.
Got it?
So that's the reason why they don't really focus on it, because they're thinking
That,
it's not injured.
yep, that, but they also haven't taken the initiative to learn about it. So this is the thing with most allied health so they taught one lecture in the whole of the degree on the SIJ.
Wow.
Okay, and that was back then was my ex-boss, but I don't know if they do it now. This is the thing. There's all these unis. I don't know if someone's teaching it or not.
So 1 hour of a whole degree is spent on it.
So there's a few reasons why, people aren't doing it. It's not on their radar.
Lack of education.
Yeah, so it's lack of education. Have no idea about it. Like Michael, my physio, goes, to be honest, Elli, my ex-boss has never even mentioned it once. You know? So it's that, lack of awareness, lack of education. Some people do know about it but don't believe in it. So there's a few reasons.
Yeah.
But it should be part of so we need to go back to the teaching level, and say, why aren't they teaching this as part of their assessments of backs in the uni degrees?
Yeah.
And that's where your 8-week course comes in.
Yeah. Well, no, the 8-week course is for patients.
Of course, yeah.
Yeah, to rehabilitate their backs.
I know.
But
it educates more people.
Yeah, to understanding. That's
it.
right. Yeah. But look, my ex-boss still teaches an SIJ course. I think, please forgive me out there if I'm wrong, but there's 2 physios that are well equipped in teaching their courses on SIJ.
Yeah.
But again, you got to want to go to it. They do advertise through the APA.
Yep. You mentioned before, obviously you've come to the point where you've grown this team now that it's under your wing, and you talk a lot about how you spoil them, to put it nicely. Now, team culture. Talk me through like your experience of obviously 10 to 15 years in the industry, and how important is team culture for you and you know someone else that's running a business as well.
Okay, so I went to some talk through the business group that I'm part of, through the Australian Physio Association, and I was quite surprised. So they had surveyed new grad physios, and now there's a lot of them, right? Where they are, I don't know when I'm trying to hire, but anyway, there's a lot of them.
Hiding under a rock.
And guess what they said was the number one thing that they were most interested in private practice when they're looking for a job?
What?
Culture.
Really? There you go.
I was shocked. I thought money. Money was up there, but culture.
Yeah. Okay.
I think it's a different generation completely to when I was a young physio. It's just even the way they approach the job, what their expectations are.
Yeah.
What's interesting is I've seen talk around how now these new young physios, they all talk about what they get paid. We never did amongst each other.
Yeah. It was very to yourself.
100%. I didn't know what anyone else was getting paid.
Yeah.
You know?
Yeah.
Now I'm happy because I go to my physio, I go to her, we do a pay review, and I said, so what do your friends get? you know? And she knows everything. You know, so that helps me that I'm, on par or above. I want to always be above that,
Yeah.
So culture is really important. And I think I'm lucky. It comes pretty easily for me. I love having fun. I'm a bit of a kid at heart. Like I love, Disneyland and all of those things. So I love it. I'm the one running the show there. Like I'm like, let's go do karaoke and let's do this. But what's really good is I'm really happy to say that we're like a family.
Yeah.
I don't tolerate any pettiness, competition or isolating people.
Comparison.
Yeah. I don't.
Not part of the culture.
No.
One thing I noticed at the start of this podcast was when you were working for someone else, this is before your mentorship, you mentioned that when you walked into that clinic, it was very systemized. Now, from what I understand about business, a very successful business is very systemized. It follows the process.
Is that the locum position you're talking about where everyone was treated the same? Is that what you're saying? That's not systemized.
Oh, it's not systemized?
No. So I would say I'm more systemized.
Really?
So that was treat what you find.
Okay. So it's different to systems. It's more
no
systems. Just treat what you find. Okay.
So notes weren't consistent.
It was just like, see me next week. We'll fix that other problem.
Yeah, so like I'd go back and there weren't any notes about that from the week before type thing.
Wow.
So it wasn't like that can happen in practices, you know. It wasn't systemized. That was the problem. So when you run a physio business, there's a certain like a system you need, right? So you need, all right, I've seen them. What's the plan? Tell the patient, explain to them how many sessions you probably think it's going to need approximately, or how long you think it's going to take. Give them a plan. Then for me personally, I need to pre-book, because if I don't, then I can't fit them in. But, you know, generally you don't do that. But if you can, it's good to pre-book a couple of weeks in advance and tell them what to expect. You can have even a booklet or something. Write it all down. This is your diagnosis. This is what we're going to do. This is what's expected of you. We have like handouts where we say this is what our next stage is.
Yeah.
So, for instance, I've got a handout that explains all of the condition and then what we're going to do next, which we call the core glute assessment, where we use like the ultrasound and an EMG machine to do assessments.
Do you have that in-house as well?
Yeah. So they know what to expect. So that's systematic. That's systems. And then, you know, the idea is, and you say to them, the idea is, well, this is my rule of thumb, right? I see someone 3 times. I don't ever see someone more than once a week unless it's a really bad acute injury. And that'll be my other physios, not me, okay? So I'll say, okay, I'm going to see you once a week for 3 weeks. By that 3rd week, if we haven't seen any change to your pain, we change the plan. The plan has to change. But if we see some change to your function, the way you move, the way you feel, your pain, sometimes you don't get a change to pain, but you feel better in the way you move and function.
Yeah.
So any type of change, a positive change is good, and that's what we're going to look for. And then we know that we're on the right track and we go with the plan. The plan can change. You can have flare-ups, you can have unexpected situations occur where you've hurt yourself or whatever. But we have a plan. And not everything we know will go the way you plan it though, right? But
Yeah, I was going to say that.
Patients feel comfortable and confident with plans.
I feel like you need to have some sort of plan to give someone.
100%.
So they kind of understand, okay, that's what's happening next.
Yeah, they can't just be said, okay, well, you've torn your hamstring. We know that takes 6 to 8 weeks to heal. So we'll treat it twice a week for the next, 6 to 8 weeks or whatever. But the thing is, why did you tear the hamstring? It can be because someone tackled you, different in soccer, right? Yeah. That can happen. I'm not saying that. But if nothing happens, you were just running and went pop, why? So you got to kind of figure that out, and then that forms the plan. Like,
so
okay,
do you deep dive with your clients, like in the holistic way, like going a bit deeper as to what happened, and even deeper
100%.
than that, like what they were doing before that injury?
Yeah, you got to know their past history. I ask pretty much anyone that comes in with a kind of lower body injury, have you had falls?
Yep.
Car accidents? And then they go, oh, I can't really remember. Okay, well, did you play sport as a kid? Yeah. I played rugby for years. Oh. So did you have any injuries while you played rugby or soccer or netball? Did you ever have knee pain? Did you have any knee injuries? Did you sprain your ankle? How many times did you sprain your ankle?
Yeah.
Because if you sprain this ankle 10 times and now this ankle is so unstable, then you're probably loading the other side, and that gives me all the little clues. So you're constantly thinking in your head, what does that mean? That means that. Okay, so that might then connect to that. And then that's how you get the pattern and you start
I feel
thinking.
like you're constantly drawing trees and little branches to different things.
Yeah, and that takes time to get good at. Do you know what I'm saying? That's experience, and that's what I say to my physios.
Yeah.
We're looking for clues. We get taught clues at uni, like this means that, and but as the years go on, you get better at it, and you've heard all these stories, so you figure things out a bit easier. A lot of it's experience too. Yeah, comes with time.
Yeah. You have a team of 4 now. So 4?
4 physios, 1 massage therapist.
Wow.
And an orthotist and prosthetist on the weekends.
And can you tell me what an orthotist and a prosthetist is?
They do orthotics and prosthetics.
Okay.
Yeah, so she's been part of the group for a long time, and she rents out the space and everything.
Okay.
Oh, cool.
Yeah.
Now, in that sort of, I want to dive into a little bit more the business side of it, because
sure.
obviously we run a business too. So to get some sort of experience or some knowledge from you would be awesome.
Of course.
In the hiring phase, at what point in opening your clinic did you know that, okay, I need to start?
expand.
Yeah, when to expand?
Oh, good question. Let me think.
Did you hit a point where you were like, I'm capped, I need someone to help me? Or was
That's what it is, basically.
okay.
So for me, that might have happened 2 years in.
Mm-hmm.
I was just like, I'm tired. I can't just do 12-hour days forever.
Yeah, of course.
Yeah, and look, I did. I had on and off physios for about maybe 3 or 4 years. For various reasons, it didn't work out. Not everyone wants to be niche or be like that. It's okay. They've got their own pathway. You know. Another one was a previous colleague of mine who you could tell really needed to have her own space, her own clinic.
Yep.
Where she had all her clients from the past. So, different reasons. But, it was when I was capped. I couldn't keep, servicing.
Yep.
But it is a big step. Like I have a friend from uni. He told me, look, I haven't taken that step yet. And it's been a long time for him.
Yeah.
So he's happy to sort of keep going the way he goes. That's fine. It's his journey,
Everyone's different in that way.
Yeah, because I've experienced that recently because we're taking like another big step in our business.
Good, congrats.
And I'm sort of passing my clients on to trainers as well. And I'm finding it hard to detach. Did you ever have that
100%.
problem? Yeah, with detaching with clients?
Even now, like I've got my little favourites.
Of course.
And when they see my other physios, I'm like, I haven't caught up with them in a while.
It's been a minute.
Let me just pop into the clinic.
Yeah. Sometimes I just go, hi, how are you?
Pop your head in.
Yeah. No, of course, that's natural. But that shows you care.
Yeah, I think so.
That just shows that, that person meant something to you because you invested in what their health journey,
Yeah.
That's a sign of a good practitioner, so a good health professional.
Awesome.
Yeah.
In terms of your clients now, what's been the longest serving client that you've had?
Oh, she knows who she is. So we just celebrated 10 years of the practice and we did a big party.
Congrats.
Thank you. And I did do my little research on the system.
Who's been there the longest?
Yeah. So I've got one that's been there from the beginning of the 10 years.
Wow.
Oh, wow.
But I have one longer.
Really?
Yes. So when I was working in Randwick, I have a patient from there. So
Wow.
that's 20 years.
Wow.
That's a long time.
Yeah.
20 years with one person.
And look, please don't think it's because she's not better.
That's like coming back.
She comes because of her job. It's a very physical job.
Mm-hmm.
She's been doing it for a long time. So rather than getting a massage, she prefers physio.
Yeah.
That makes sense.
So it's her self-care, her maintenance therapy.
Yep.
But she's really good.
Yeah, wow.
Like she doesn't have any major issues. Goes to Pilates and has gotten so much stronger because of what we've taught her.
Yep.
Oh, this
So-
is a Pilates girl, right?
No.
The one that's got a
No,
six
different
pack?
No, that's my cousin. Now she's in Greece with the six pack. But I'm proud of that one. But that's what I mean. As long as you know how to turn your core on properly.
Yeah.
Some people though, I'm going to bring this up. Some people you need to show them over and over again.
Yes.
Of course.
It's because they've been doing it for such a long time, thinking that that's the right way.
You know
So
what
it's really
it
hard
is?
to unlearn.
It's yes, but no, what I mean is you teach them once, you think they've got it. Then something happens and they lifted up something heavy while they were moving house and you don't I've been caught out where I thought they still would have known,
Yeah.
but because of the injury and the pain that sustained, they lost
That little connection.
connection again. And I think I took for granted because I'm a physio, we're all physios. I had this talk with my staff the other day. I think we take for granted that we understand our body a bit better, but they don't. So realised that sometimes we need to just get that ultrasound machine out every now and then and have another quick look. Are you doing it properly?
Yeah.
And that was what was actually happening with this patient is she lost her proprioception. So proprioception being that spatial awareness, that connection,
Yeah.
because of that pain episode.
Wow. So how would you explain to people that might not know how to turn their core on? Because I feel like that's
There's so many cues, yeah.
That's a common thing for people to say, like, oh, switch on your core. Or like, how do you actually define that?
Well, you have to remember, number one, the core is made up of 3 muscles,
Yeah.
okay? Pelvic floor, transverse abdominis, and multifidus. Okay? But when we say the core, it's mainly pelvic floor and transverse abdominis. So the number one thing people do wrong is they don't turn on their pelvic floor with the transverse abdominis. So they get told belly button to spine or stuff like that. That doesn't always work.
Or the common one is pretend someone's about to punch you and that feeling.
I've actually never heard that one.
Oh, you haven't?
That's a new one for me. So the problem with that is you're not engaging your pelvic floor.
Yeah.
Then it becomes a little bit more complicated, mainly for women, because they can't have, they can't have any pelvic floor issues. If you just say, imagine you're busting to do a wee and you try and stop yourself, that is okay, that's good. Or, drawing up a tampon or, an elevator up a shaft or whatever, that's good. But you've got to be careful that none of those, because it's very common. This is another area that you boys might not know about. But
educate us.
Yeah, a lot of women might have pelvic floor tightness. And I will say to you, I've seen in my clinic, I work with a gynae and she sends me patients that she's picked up have what they call vaginismus, which is pelvic floor tightness, hypertonicity, but possibly the driver is not gynecological. So endometriosis, there could be one driver, okay? So she's gone, and she's worked with me as well as being my patient. So she understands the SIJ in the pelvis and how you can injure it and that can drive problems, okay? So she has sent me a few patients where they're all women in their 20s who have pelvic floor tightness, painful intercourse or insertion of like tampons and stuff, and they will come to me and say, I don't know why, like some of them don't have endo and they get Botox, but it doesn't last.
Oh, yeah.
Now, if Botox isn't lasting and it just keeps coming back, what's the driver is the question. So this gynae is amazing. She can then go, I think something else is going on structurally here. So she'll send them to me. I have a look and we start diving into, like you said, what's going on. Mm-hmm. And I realise they're lifting some heavy weights at the gym.
Okay.
You told me about this.
Yeah, and the problem with that is they are either really butt squeezing, where you see all these people doing it, tailbone tucked in, squeeze right at the top of the thrust or the end of the squat, or they're not, the weight is so heavy, they cannot maintain intra-abdominal pressure.
Yes.
So they are bulging at the tummy, that's putting all the pressure down onto their bladder, their pelvic floor, and what's the pelvic floor got to do? Grip.
It's like an extra hand.
Yes.
Yeah.
So that's another whole area,
This is such an important topic because I feel like a lot of people do this, right? They go to the gym, they really want to focus on getting bigger glutes. This is the female world. And they'll start doing hip thrust and hip thrust and hip thrust, Bulgarian split squats, whatever it is.
But with big weights too.
Yeah, big weights, but they won't focus on developing their core to the same standard. They're focusing on their glutes.
They can do those weights, but exactly.
Their glutes are strong. Their glutes are strong enough to do it, but their core eventually won't be able to handle that 200 kilo hip thrust that they're doing.
And that can come with a plethora of issues if that's ongoing.
Yeah.
And one of them is the pelvic floor. So we can't just sort of go, all right, everyone suck up their pelvic floor without really making sure that no one has an issue like that.
Yes.
Yeah.
So would you recommend people to exercise before getting pregnant?
Oh, 100%. That is a big factor and in between.
Yep.
Okay, because I was really young and I didn't know enough back then. I had my first baby at 25. And, even though I was a young physio, I hadn't delved deep enough into all of this yet. And it's happened more with time over the years with the industry anyway. And I didn't. And I'm lucky that it's not too bad, but I did have issues because of it. I didn't strengthen in between my children enough. And you should.
Yeah.
Yep. Especially because you want to, help avoid things like abdominal diastasis, separations, which I ended up having. And from my first kid.
And that's pretty common though.
Very. So
women do.
you're meant to separate because that's how you can have room, but it's how it comes back and whether you've torn the whole linea alba or not. So unfortunate for me, I tore the whole linea alba, so I had to get that repaired.
Yeah.
Yeah.
That would have been fun.
Is that surgery?
You don't realise obviously that's
Of
happened.
course.
And I knew I had an umbilical hernia, but what we were taught was to look for like the width of a separation, but it's actually more the depth. So if you can put your fingers in and it goes all the way down
Yeah.
and there's nothing stopping you,
Yeah.
then that's a problem.
Oh, yeah.
Oh, wow. So it's just like straight in.
Straight in.
Oh, gee.
I
that's
always
what I
just
had.
remember it being the width, never the
Always taught about the width, but it's about the depth. The
Okay,
depth
that's
and the
interesting.
length. How far from top to bottom as well.
Yeah.
Yep. So I was top to 2 centimetres above my pubic symphysis.
Oh, yeah.
Whole way. All the way through.
Really?
Yes. With an umbilical hernia too. So I had an upper GI surgeon repair.
Yeah.
Yeah. Through like keyhole surgery and stuff. Yeah.
So what's some advice that you would give someone going into being pregnant prior to, what would be some advice that you would give them to do before pregnancy?
So a lot of women's health physios are really good at doing assessments.
Yep.
If they want to have an internal assessment, figure out if their strength is up to scratch to help with the pushing. I know that they also do like preparation for birth. If they don't want to do that, then seeing someone like us with an ultrasound machine and we can have a look at their pelvic floor and abdominals and just give them some strengthening to do or make sure and screen them for like, as I said, hypertonicity or other issues that might affect their ability to give birth.
Yeah.
And prevent incontinence issues later or prolapse issues, yeah.
Would you say that's part of a sling?
Which part?
Like the pelvic floor
yeah,
and
it
the
is known as-
core and everything like that?
Yeah. So the pelvic floor is known as a sling, the group of the muscles. And then what happens is there's a fascial attachment to your transverse abdominis.
Yeah.
So you know how I describe it? I always say to my patients, it's like wearing a pair of those corseted undies, you know? So you've got your
Oh,
sling.
the ones that suck everything in?
Yes.
Yeah.
So you've got your sling underneath, okay, which is the gusset part of the undies. Then you've got the panel that goes up to the top here at the front because you've got your lower, mid, and upper TA.
Yes.
Yeah? And then you've got the multifidus at the back that's attached via the fascia, the thoracolumbar fascia.
So your lower back.
So literally put on a pair of those corset undies, that's your core.
Wow, okay.
Yeah.
Yeah. I don't
Yeah.
feel like anyone understands that.
Yeah.
Yeah.
So you can't, so your core has 3 components, all right? It's our job to figure out which part of the components isn't working,
Yeah.
but particularly in any type of back pain, back, pelvis, hips.
So you guys would be looking at all of those sections.
Yeah.
Yeah.
So that's where I say we do that assessment, like to make sure, because you might have an amazing pelvic floor, but your TA is dead, does nothing. That's happened many times.
Or
Wow.
it could be the other way around.
Yeah, or both. Multifidus is the first muscle to go though in back pain. It's gone.
That's the lower
Switches
back,
off.
isn't it?
Yeah.
Yeah.
So it's the deepest muscle that sits on the spine. And I'm such a nerd. I was completely blown away when I first heard this. It is responsible for all of the proprioception, which is the spatial awareness that is needed for your spine. It's in multifidus,
Wow, okay.
not in the joints.
Really?
Yeah.
There you go.
So it is so important.
So any turns of any twists or turns, everything like that, that's coming from your lower back.
So your stability comes from multifidus. Okay, so your lower back is meant to bend and extend and only turn a little bit.
Yeah.
Okay, your multifidus needs to work tonically, so all the time, in giving feedback to where it sits in space and giving it that stability that it needs to control movements.
No matter what's happening.
But not only with movements, like how many people say, I can't stand for long, I'm in pain. It's
lot of
static
people.
postures, as well, like sitting, being able to sit upright properly for a while and stand. It's multifidus. And then we start with multifidus and then the rest comes into it.
I may have missed it, but what is multifidus?
So remember, it's the third muscle of the core.
Okay.
So it forms.
Do you count 1, 2, 3 or?
Okay, so pelvic floor number 1,
Yep.
transverse abdominis number 2,
Yep.
You wrap around
Okay.
via the thoracolumbar fascia to multifidus number 3.
Okay.
And multifidus runs from your neck, C2, I think, C2 or 3, all the way down to your sacrum, S4.
And people would explain it as those two muscles that go along your spine.
Under the rods. You know, I said there's rod muscles?
Yeah.
It's under that,
Also deeper.
right on the spine. But so important. And guess what happens when that muscle wastes away in chronic back pain? Something goes in there instead of it.
What is it?
Fat.
Feels in there.
Wow, okay.
Why?
It's called fatty infiltration.
Okay.
And unfortunately, you can improve the multifidus. But yes, that can happen. And that tells us, that's a huge clue. It tells us that patient has had issues there for a very long time.
Okay.
So
We could see it on
replaces-
MRI.
Okay, so it replaces muscle with fat? Wow. And how long does that take to develop? Is that just an over...
I don't know the answer to that
Okay,
one.
okay. Too deep of a question.
I need to look at the research of that one.
Okay.
And how do you strengthen that muscle?
Good question. It's not an easy one. They did research many, many, many years ago in the 80s, and we still sit on that research that it works, is any perturbation to balance. Turns it on. Okay, so what that means is if you're standing in good posture, not rigid, just comfortable, and someone pushes you,
Switches on.
it should switch on.
Oh,
Okay.
Okay, so that means that's how we train it. We turn it on with a small perturbation. So we tell people to rock forward onto their toes, lift their heels just a centimetre off the ground, and that should switch on multifidus. It won't if you're like this doing it.
Yeah.
All right, you've got to
have to
be in
be
neutral
full
spine.
upright.
Neutral spine,
yeah.
comfortable neutral spine. And you will see it switch on. Some people better than others, but it's a starting point.
Okay.
It's a
So if
starting
he's
point.
standing up straight, I just push him over for a bit.
Or if you just give him a tiny nudge,
Oh, he does it anyway, so it's
his
fine.
multifidus will turn on.
My multifidus is on all the time.
I'm training you, man.
No, thanks, man.
So like I was watching you feeling a little bit uncomfortable in your chair
Yeah,
before.
well, we're talking about the back, so I'm just adjusting every
and I'm
couple
thinking
minutes.
that's when you know your multifidus isn't switching on.
Yeah, mine is definitely weak after speaking.
It's because he's so tall, so he has to
Yeah,
sort of
yeah.
lean
My
down a little
torso
bit.
is
Yeah,
very
yeah.
long, so I actually have really bad posture. I used to have really bad posture where my shoulders used to round.
Yeah, I'm not going to analyze you now though.
No.
no, because I already have.
Okay,
I could tell. He's already connecting all the trees.
I could tell.
I could see all the trees.
Yeah. I'm very bad.
I
with my
can't
posture.
help it. It's so bad.
No, it's fine. It's like us with personal trainers when we're at the gym.
Yeah.
We're like we're sitting there across the gym. We're like, oh, don't train them like that. That's wrong.
I do that when I go to the gym.
Yeah.
Yeah.
I saw someone using TheraBand doing the rotator cuff, and they weren't doing it right. And I'm just like, oh my god, what are they doing?
Oh, it's the best. I still watch that from across the room now. I'm like, nah, I can't do it.
I know.
A lot of years of experience, a lot of great knowledge for
Thanks.
even us to take on
Yeah,
board.
I'm glad.
What's one bit of advice that you would have given to your younger self that maybe
yeah.
someone else can pick up some advice from?
I've come to a crossroads in my career where I hope to have about 20 years left. Yeah, so I'm halfway through.
Yeah.
But it's a physical job,
Yeah.
and I didn't understand that going into it at all. And, I think that I wish I probably trained a bit better and looked after my body a bit better, because then I could handle what I'm up to right now, because I've had the 3 kids, I've had the diastasis, I'm trying to play catch up
Yeah.
in my own body to be able to give myself another, say, 15 years of treating. I don't know if that's my goal though, because I am a business owner, and the whole point of having a business is that you can walk away a little bit too. But I don't think I can ever stop being a clinician. And I'm going to get all these business people in physio going, you're crazy.
Yeah.
That's what you should be aiming for. But I don't think I can. I love it.
Yeah.
So I will balance myself out a bit better, I think. And I think that's what it is learning balance better.
Balance is huge.
Yeah. I really took advantage of my youth
Yeah.
and how much I could do. Like I could do so much and I was invincible basically.
Yep.
But it catches up with you eventually. I'm doing all right, but I fell down my stairs and I said I injured my SIJ. So now I'm dealing with that, and physically having to treat people, and we are hands-on physios, so it is more physical. I think just learning how to look after myself a bit better, so it's a bit of more self-care and balance a bit better.
Do you feel like that your role as a clinician can evolve over time?
Yeah, definitely.
Yeah.
It's always evolving.
Because you can still be a clinician without being as hands-on in the
100%.
future, right? Yeah.
But that's all up to me.
Yes.
And letting go. So that's my journey, my personal journey.
Yeah.
And people want you, they need you. And that's a big part of it is that was hard. Like going on maternity leave, they accepted that. You've had a baby, you've got to be on. But taking time off, I feel like I've always got to have a good excuse for it.
Especially as a business owner, right?
Yeah. But more, I feel like I know my clinicians. My patients. When there's a need, there's a need. That's why upskilling my staff has been the best thing that ever happened to me. Because I took my first big holiday like 2 years ago. Took my kids, to Europe for 6 weeks. I could never have done that in the past. I'd never, I actually thought about it. Do you know that whole 10 years I worked for everyone else? I took 1 week off every year.
Only 1 week?
Yeah. I wouldn't do that again, ever. But I did that. 1 week.
Yeah. So that's the advice you would have given yourself is have a little bit more balance.
Yeah. Balance, which is what I'm doing for my staff.
Yeah.
Oh, you want 2 weeks off? Yeah, all right, let's see. Does it work out with timing? Perfect, no worries. But, you take and give, as I said to you.
Yeah, within reason.
Yeah, within reason.
Give yourself that plan. What kind of legacy do you want to leave?
Oh, gosh. Okay, so with physio, back to evolving, I love teaching. And it's something that I really want to do more of. And this is sort of why I reached out. So I was doing it. Now I haven't done it for a while. So I kind of want to get back there again. And that's what I want to leave is I want to just educate physios who are in the industry that, have the passion and are looking for that thing.
Yeah, that drive.
That drive, the niche, whatever. That's what I want to do. And just keep helping people.
That's it.
Yeah.
Awesome.
Yeah.
I like it.
Thanks, guys.
And where can people find you on socials?
Okay, so it's Physio Rehab Health on Instagram, and that's the website, physiorehabhealth.com.au.
Yep. You're just located in Carlton, yeah?
Carlton on the Princess Highway.
Awesome.
Next to Domino's, I think. New Aldi there.
Oh, you're right there?
Yeah. So the yard is next door.
Oh, you're there?
Yeah.
Okay. I didn't even know.
Locals. It's literally 8 minutes from here. I just drove.
Yeah. Timed it.
And this is my hood. I grew up, in the St. George region.
There you go.
Yeah. Never want to leave.
Friendly neighbour.
Good area.
Yeah, it's good, isn't it?
It is.
Yeah.
Thank you so much.
Thanks.
Appreciate it.
Thanks,
Thank
boys. Thanks. Awesome.
Thank you guys for listening to this week's episode of the Evolve podcast.
Brendan and I have loved having you throughout this whole podcast. Make sure that you like, comment, and subscribe. And if friends are interested, share it around.
Yeah, make sure you share and tag us on your Instagram posts, and I'll see you soon.